Welcome back to Skinfluence. I'm Dr. Dustin, board-certified dermatologist, and I'm joined as always by my co-host, Austin.
I'm Austin Lee. I'm a physician assistant here at Dr. Portela's practice.
And today we're breaking down the skin barrier, or rather talking about how your skin barrier gets broken down.
Yeah, we don't want to break it down.
We don't want to break down your skin barrier.
We'll build up your skin barrier.
We're going to repair it. We're going to give you all the information you need on your skin barrier, why you get irritated skin, and how to fix it. So what is the skin barrier?
The skin barrier is the top layer of our skin, essentially what we call the stratum corneum, and it's what protects the rest of our body from pollutants. It helps regulate temperature. It helps keep our body healthy, regulate touch, and it allows your immune system to adapt appropriately to certain things. So it is involved in so many other things than just tactile touching the skin, touching things. The skin barrier is the first line of defense, as we say, for many different things. But essentially, it's what you've talked about before, the bricks and mortars. It's the skin cells and the attachments, the desmosomes and hemidesmosomes, and the different things that, and the immune cells that regulate basically everything in our skin and tell our body internally what's going on the outside.
The skin cells are like the bricks of a brick wall, and the mortar is made up of ceramides, free fatty acids, lipids. All of these things together kind of it's a waterproof barrier. It keeps water from getting absorbed by our body and making us change our pH and osmolality. And it also has a slightly acidic quality to it. So obviously we know that like your stomach has acid in it. It's a really, really acidic environment to break down food. And the water that you drink needs to be relatively a neutral pH.
Right.
But your skin barrier sits at a pH of about 4.5, and that helps to fight off microbes like bacteria, viruses, and fungi. And it's one of the reasons that when people would use soap, like traditional lye soap, which is very basic, it would tear up the skin barrier because it would neutralize the pH of the skin barrier, something that we call the acid mantle layer when you look under a microscope. I don't know why they call it the acid mantle layer, but it is acidic. And so things like lye soap would just tear apart your skin barrier. And I know that plenty of times as a teenager, I didn't use lye soap, but I used traditional soap to wash my face. And it really makes your skin dry.
It does.
So there's a lot of things that can damage the skin barrier.
Well, you spoke a little bit about breaking down the skin barrier and what soap can do. What are some of the signs of a skin barrier that's broken down or not functioning well?
When your skin is going to tell you things. So if you're frequently itchy in an area and you don't have like an obvious rash, if you're itchy all the time, if your face or your skin elsewhere feels dry and tight, your skin barrier is likely to be compromised. If you're putting on products, even those that might say they're for sensitive skin, and it stings or burns. I've had patients that say, I was using Cetaphil lotion and it stung. I'm like, your skin barrier is so compromised that even fragrance-free products are causing a problem. We really got to work on repairing the skin barrier. So sensitivity issues, burning, stinging pain with product application, those are all signs your skin barrier might be damaged.
Redness, flaking, ulcerations, things like that you can see are also all signs that your skin barrier isn't functioning properly, it's breaking down, or maybe it's broken down and now these things are happening because you had a compromised skin barrier that you didn't take care of.
So what are the things that people do to break down their skin barrier? Now, sometimes it just happens, but sometimes people are doing things.
So things that people can do very often, so damaging the skin through cosmetic procedures. So at-home microneedling, or especially the derma rolling at home, can break it down. You're puncturing, lacerating the skin. One of your favorite things of all time, the apricot scrubs, are those damage the skin barrier. Sugar scrubs, when you're rubbing something abrasive against your skin, hoping to maybe break up debris or things like that in the pores, you're really just damaging the skin. Overusing actives like salicylic acids, glycolic acids, retinoids, retinols. If you're overusing things like that, and your skin's really turning red and flaky and it's really irritated, that can do it. Scrubbing the skin. So people think, I'm going to really exfoliate my skin really well, and I'm going to rub a loofah or something really rough against my skin. That's going to break down your skin barrier. Those are the things that are coming on the top of my head. Anything else you want to add to that
No, I do
list?
see it all the time where people, they listen to things online and they get into a skincare routine and they start doing exfoliators like AHAs, BHAs, they're putting on a retinol, and within 4 or 5 days their skin is so angry because they've just obliterated their skin barrier. So there's a lot of things that you can do to mess it up. And of course, physical scrubbing is one of those. Definitely what I was guilty of, like in high school and college, was the physical exfoliation.
Yeah,
So
same.
there's environmental things too.
Totally.
Environmental things that we get exposed to. So if you are working in an environment with chemicals, if you get that stuff on your skin, that may damage the skin barrier. If you are in a really cold environment, that wind, we all know what wind burn is.
Totally.
That's damage to the skin barrier. Excess heat could cause it as well. And so using long, hot showers, again, going back to overuse of hot tubs, those are the types of things that can also take a toll on your skin barrier.
Totally. And excess sun.
Excess sun, it does.
Getting sunburned, or not even getting burned, but just being outside without any sun protection can just cause just some irritation to the skin as well.
We rely on things, on cells inside of our skin to produce the lipids. Our keratinocytes are producing filaggrin, which is a protein. They're producing ceramides. And when our skin is insulted, whether it's by UV or chemicals or a host of other things, they can't produce it as quickly to repair the skin barrier.
Sure.
So it's critical that you're gentle with your skin, even when you're trying to make changes through actives.
Totally.
Now, just having a damaged skin barrier, unfortunately, is not the end of the road. It can put you at risk for a whole bunch of other problems in the skin.
Yeah.
Namely, allergic contact dermatitis.
Yep.
Because if you have a damaged skin barrier and all of a sudden you put on a product like a perfume, let's say, and it can get right in and touch your immune system if it's not being blocked by your skin barrier, and your Langerhans cells or your immune system see it, they will form an allergic reaction to it. So products that you have used for years, if you put those on a compromised barrier, the risk of becoming allergic to it is significantly higher, and that could be a permanent thing. You'll never be able to use that product again.
Totally.
So it really can make everything worse.
Yeah. And other things that we see, there are conditions that damage our skin barrier, like eczema and psoriasis, things like that. And we see in especially in those types of people. But if you're not protecting your skin barrier or helping it maintain a good skin barrier, infections can get in. Viruses. So we see eczema herpeticum, which is basically the cold sore virus going wild in people who have damaged skin barriers. Fungus gets into our skin, especially in our feet. Starts in our feet a lot because we're not taking care of our skin barrier. We don't think about our feet that often, and so infections can find their way into our skin a lot easier if we're not taking care of our skin as well.
That's a very good point, because we do see that in diabetic patients with stasis dermatitis, that swelling of the legs, their skin gets broken down, and they're more prone to getting infections on the lower leg that could lead to cellulitis.
Totally.
And that can be, in some cases, deadly.
Yeah.
So maintaining your skin barrier can save your life in some circumstances.
Yeah.
Not to be too dramatic about it, but
it could.
There's definitely risks associated with a damaged barrier. It is a critical part of our immune system.
Yeah.
So we've kind of established the function of the skin barrier, what it is, what it does. So let's move into some Did You Know?
Yeah. So did you know, talking about the skin barrier, that when we damage our skin barrier, if it's a superficial damage, it can take weeks to heal. But if you really damage it or you're just not taking care of it, it can actually take months for your skin to heal properly from the damage that's been done to it.
Yeah, because you're not just stripping away the things that are there, you're damaging the cells that are there to repair it, to produce those proteins and lipids.
Exactly right.
And this is something sometimes we do intentionally to people with laser resurfacing procedures.
Yes, we do.
And that's why we tell them, you're going to have downtime. You're going to have 1 to 2 weeks of downtime. And that's just to the point where they're functional, that they can go back out into the world.
Yeah.
You know, where they might be okay getting exposed to things and less likely to get an infection. But the reality is sometimes that redness can take a couple of months. And I think I've had some patients where we were really aggressive with the laser. It took 3 or 4 months for all of the redness and the sensitivity to go away. But they knew what they were signing up for.
Yeah.
And they wanted that result. But it can take a long time.
It can take a long time. Even when we do cutaneous surgeries, when we're removing cancers and things like that, we're damaging the skin barrier. We're cutting through the skin barrier, and then now it has to repair. And it always surprises me when my patients say, "Yeah, we have to leave the stitches in for 2 weeks," and like, yeah. I mean, that skin has to heal.
Yeah,
and it takes time.
It does. It takes time, and that's why after surgery, when people start putting on Neosporin, they're much more likely to get allergic to it.
Yes,
when they don't need it, because it can get right in and be seen by the immune system.
Exactly.
So my little bit of trivia is: did you know that elephants have the largest stratum corneum of any animal?
You know what? It would make sense.
Yeah. I mean, they've got that thick skin. So they have the largest skin barrier of any land animal ever. And it can be several millimeters thick, which is, our epidermis in most places is under a millimeter in total. But the sperm whale has the largest integument system of any animal ever. Yeah. And when you look at the outer layer of the skin, the inner layer of the skin, and their subdermis, the blubber and everything that's similar to our fat layer, it can be up to 35 centimeters thick.
35 centimeters.
Mm-hmm. So,
I just can't comprehend that, really.
Yeah.
That's
yeah, it's pretty wild.
Yeah. That's a deep surgery for cutting out skin cancer on those things.
Yeah, I've never had to cut out a skin cancer on a whale.
Yeah.
But I am up for the task if that was needed. I'm not really, but
now we know if there ever is one, call Dr. Portela.
I wonder if elephants get skin cancer. I'm sure they've adapted to be,
interesting. I wonder.
Pretty well cared for in the environment that they live.
Yeah.
So we are not so much. Though.
No,
we get burned and we get skin cancer. We have not adapted to not get skin cancer. So, but some interesting facts. Yeah. So now that you've damaged your skin barrier, let's go learn how to repair it.
So now that we've talked about what is the skin barrier, what helps break down our skin barrier, let's talk about some techniques that we can do or you can do at home to help repair your skin barrier. And step one is evaluate the things that you're doing. Look at the things you're putting on your face and make sure that you're not putting on too many active ingredients. If you are, if your skin is red, it feels tight, if it's flaky, if it's irritated or itchy, take a break from the actives. Take a break from the salicylic acids, the glycolic acids, from the retinoids, and use something like niacinamides or use something like hyaluronic acid or things that are going to help moisturize the skin, help lock in moisture, provide maybe a barrier layer where moisture can't get out. And for a few days, for maybe up to a week, depending on how severe your irritation is, you're going to want to use things like that to help repair it before you go back to using those products. So simplify your routine. If you're using too many actives, cut it down to maybe 1 or 2.
When I have patients that come in with perioral dermatitis, which is a skin barrier problem, or like just a lot of sensitivity, I will say you can't wear makeup, you can't use perfume, you can't use your retinol, you can't use AHAs or BHAs for 6 weeks. Because we really want this to settle down. Yeah. And we don't want it to just barely get healed and then have you reintroduce products.
Totally.
And so many people don't like when I tell them you can't wear makeup for 6 weeks.
Yeah.
But that's really sometimes what it takes. And then you get rid of all of the actives and we're just going to look for skin barrier friendly ingredients.
Right.
And that's going to be things, in some cases, the only thing that they can tolerate is plain Vaseline, like petrolatum. Because it forms a barrier. It doesn't have any moisturizing properties in and of itself, but it just creates that barrier layer that your skin doesn't have so that it can heal from the inside.
Exactly.
So petrolatum's a great skin barrier ingredient.
Yeah. And it also acts as, like you said, a barrier to help heal, but it protects it as well. It prevents infections, prevents bacteria and things like that.
Prevents water loss. Glycerin is another one that I like. It's a humectant, so it binds water and helps to hold it there. So it will bring in excess water. It is a hydrating ingredient for the skin. It's not just an occlusive. Urea can be really good as well, but if you're real sensitive, if you're having a lot of sensitivity, urea might sting a little bit, so you have to be careful with that.
Yeah, a lower percentage urea should be okay.
Yeah, it's likely going to be good. Niacinamide that you mentioned, hyaluronic acid can be helpful. Panthenol, vitamin B5 is good. really good. It's in Cicaplast Balm
That's
B5
right.
because it does have a lot of calming properties to the skin. Lanolin, which is one of the big ingredients in Aquaphor. Castor oil, I'm generally fine with. Castor wax.
Yeah.
When we look at Dr. Rogers' Restore ointment that we've talked about before, it's glycerin, castor oil, and castor wax. It's about as hypoallergenic as you can get.
Yeah.
So those are all things that you might want to look for. And a whole other conversation, we won't get too far into it, is while you're repairing your skin barrier, you can use ingredients that will help to promote the microbiome to recover on the skin, because we do have bacteria, viruses, and fungi that live on our skin.
Right.
And they're not pathogenic, meaning if they got in, they're usually not going to cause an infection, but they take up space and they prevent bad bacteria from finding a place to live.
True.
And we know that our patients with eczema, they have a problem with the skin microbiome. The good bacteria are not there, and they get infections much more easily.
Yes, they do.
And so there are steps you can take, and we'll recommend one at the end that can help to improve the microbial diversity of the skin.
Right.
So
those are all good techniques. Another thing to be aware of is how you're cleansing the skin. So people, oftentimes when they feel like they have an issue, they want to really clean their skin well. We want you to be really gentle with your skin. I typically don't recommend when people are cleaning their skin to use things to clean their skin outside their hands. I say rub the cleanser on, it's going to do their job. And if you're having skin barrier issues, if your skin's dry or tight or things like that, use a gentle cleanser. So there's CeraVe, Cetaphil, La Roche-Posay, every brand has their hydrating cleansers that I find work very well. They're very soft on the skin. They don't feel too irritating when you're done afterwards. You don't feel that tightness. It sometimes feels good every once in a while. It feels like, something happened. I'm doing something.
It's not true.
That's not necessarily the case. So using a hydrating cleanser and then avoiding really hot water like we've talked about.
Yeah, just barely warm water is going to be better when you're dealing with skin barrier issues. And if you're really sensitive, sometimes it's totally okay just to use water. You don't even have to use a cleanser.
Yeah.
When I do laser treatments on patients and their skin barrier is just completely trashed because I just melted half their face off, I will have them just use water for 4 or 5 days.
Yeah.
After 3 days or so, they might add a teaspoon of white vinegar to the distilled water that I'm having them use, because that will help to reduce the risk of bacteria getting on their skin. But they're not using a cleanser for almost a week in that case.
I would agree with that.
But that's just, one approach that you can do. If you're doing all of these things, like you've cut out all the actives, you are moisturizing like crazy. I mean, you can't apply enough moisturizer, I think, when you have a broken skin barrier.
Yeah,
There's
I agree.
nothing wrong with doing it 2-3 times a day. Put it on in the morning. Sunscreen, probably a zinc-based sunscreen to help protect. I think you're more likely to have sensitivity issues if you're using a chemical sunscreen on a really sensitive skin barrier. But you can moisturize in the afternoon and in the evening. I mean, you can really layer it on. When I laser my own face, I'm carrying around Dr. Rogers Restore or Avène Cicaphate, and I'm putting it on 3-4 times a day.
Yeah, I agree. On a little bit more of a holistic level, if you're having skin barrier problems or if your skin's breaking down really easily, you feel like there's a lot of irritation, your skin is going to heal the best when you're getting good quality sleep. And so if you're staying up late and you're in front of the TV or you're staying up late on your phone, that's not going to help anything. You need to be getting good. The best time for your skin to repair and where it's going to repair the most is not during the day when you're out and about and there's pollutants and sun and everything touching your skin. It's while you're resting and getting good quality sleep at night. Yeah,
absolutely. Make sure your diet includes plenty of protein.
Yeah.
So you need especially a lot of arginine in wound healing situations.
Arginine,
is really important. And if you have a broken skin barrier, you got to have enough protein in your diet, avoiding junk food, avoiding lots of sugars, avoiding alcohol.
Right.
Sleep, as you mentioned, is critically important, and be well hydrated.
Yes.
Because when your skin barrier is broken, you're actually losing water through your skin. It might not be like obvious where you can see water build up on the skin. After I laser a patient, they wake up with serum all over their face the next morning. Like it's just oozing out of them because they are losing water. But even if you just have a rash on the skin, some eczema, you're losing more water, and it is easier to become dehydrated. And if you don't have enough hydration inside the body, it is harder for your skin to repair itself.
Yeah, totally. So those are good practices to do when you're at home, aside from doing the cosmetic cleansing the face and barrier protection with emollients and things like that. There are things that you could be doing in your lifestyle that could be benefiting your skin. And maybe if you're doing those things and you're still you've been trying all of the different products and you're still struggling with that, look at your lifestyle. Maybe there are changes you can make to help improve that.
Is there a role for dermatology providers to repair the skin barrier?
There is a role. Yeah, there definitely.
Softball question of the day.
Yes. So if you're struggling with any of these issues that we've been talking about, go see your dermatology provider. I've mentioned this before. There are so many times where people come in because they have a simple, what's to them, it seems to be like a simple question, because we kind of, when we talk, we kind of paint with a broad brush, but sometimes people need a very specific plan for them, their skin. Maybe they have something else going on that needs to be diagnosed, like perioral dermatitis you had mentioned. And so if you're struggling for more than a few weeks of trying to repair your skin barrier, if your skin feels irritated or red or tight or itchy or whatever it may be, it's never a bad time to go see a dermatology provider, because we can provide tailored techniques for you to be doing. We can take a look at your life. We can take a look at your habits. We can take a look at your skincare routine. One thing that I would do if you're struggling with things like that is bring all of your stuff in that you're using, because when you get here and you can't remember, it's hard for us to say, use this, don't use that. So bring the things that you're using and we can help you out.
Yeah, we can just pick and choose which ones you can keep using, which ones you shouldn't use. And then we'll be able to prescribe medications that will also help to reduce inflammation in the skin.
Yeah.
Because time and time again, when you get in this cycle of a damaged skin barrier, your immune system becomes overactive. It's looking to try to solve the problem, but sometimes having all that inflammation makes it more difficult for the cells to repair that acid mantle layer.
Right.
And on the body, there's definitely a role for the short-term use of topical steroids, things that are stronger than hydrocortisone that you get over the counter. And when you're educated, when you work with your dermatologist to understand how to use it, how much to use it, how frequently to use it, then you can knock out that inflammation and give the skin time to reset. If you're dealing with problems on the face, I personally like to use steroid-free options that are available by prescription. Things like pimecrolimus or tacrolimus. They are not steroids. They don't thin the skin. They're not going to lead to the kinds of side effects or steroid withdrawal symptoms that some people deal with from steroids, but they will knock out some of that inflammation and give your skin time to repair. I use them frequently in perioral dermatitis, sometimes in rosacea in the rare cases. Metronidazole topically reduces inflammation. We have new things like Vitama, Zorev, and Opsilura that are steroid-free. So there are a wide range of options that we can use to reduce inflammation in the skin, give your body the tools to repair itself, and get you back on the right track so you can reintroduce the products that you want to use.
Yeah, I agree with all of that. I use pimecrolimus and tacrolimus quite often for the same reasons. So.
Yeah. And if you are using any topical steroids, it's important to know you still have to moisturize.
Yeah.
Now, they will reduce inflammation. They may take away redness quickly, but they don't repair your skin barrier. By themselves, they will make it even longer for your skin barrier to repair itself unless you're using a moisturizer every day as well. So even though that triamcinolone cream feels just like your CeraVe cream in some cases, it's not a moisturizer. It has no ingredients that will hydrate your skin.
Yep, totally.
So that's something your dermatologist can educate you about and come up with a plan that's going to work for you.
Yeah.
So as we wrap up, we want to show you guys our product of the week. And this is a collection from Aven, some of my favorite products to help repair the skin barrier, the same products that we use after laser procedures or people that deal with extreme sensitivity. And there's kind of a multi-step process, but the first thing that I like to do is use the Aven thermal water. So this is sterile inside the canister. And when you're really hot after a laser treatment, that feels great to spray on your skin. And this also, things like this and the La Roche-Posay spray have been shown because of the high mineral content to improve microbial diversity on the skin. So it promotes more growth of good bacteria, more diversity of the bacteria, so you're less likely to deal with infections. And then you layer on top of that the Ceculfate Plus. This is a really thick, moisturizing cream. It is fragrance-free. It is about as gentle as you can get with the exception of like plain Vaseline. And it's almost feels like Desitin, like diaper rash ointment to me. But it is a miracle worker for sensitive skin. And then the other one that I have here is called Xeracalm AD. If your skin is dry, irritated, and itchy, this has extra ingredients that help to turn off something in your skin called substance P, which propagates the itch signal from nerve to nerve. So that's very good if you're really itchy. And I love the packaging because the way that this pump is formulated, the contents remain sterile until it comes out of the tube. So you're guaranteed to be putting on a sterile cream on really sensitive skin. So we'll have links to those down in the podcast show notes and the YouTube video description for those that are watching. But the Avène collection is about as good as you can get for dealing with a broken skin barrier.
Yeah, I totally agree with that.
So as we wrap up, I'm Dr. Dustin. You can find me on all social media platforms at Dr. Dustin Portela, Dr. Dustin Portela. And make sure to hit us up on Instagram at skinfluence_pod. And we want you guys to tag us, take a picture of when you're listening to Skinfluence Podcast. And if you post that picture to your Instagram story and tag us, we are going to be doing a giveaway. Multiple giveaways actually, but the only way to enter is to make sure that you're following Austin Lee PAC, Dr. Dustin Portela, and Skinfluence Pod, and then tag us in an Instagram story showing us the screenshot of you listening on your phone or of it playing in your car or wherever, and then we will choose winners and we'll announce those through our social media on Instagram. So look for lots of giveaways because we have a ton of amazing skincare to give away.
A ton of it, and it's all good stuff, and so I look forward to seeing who gets it.
Yeah, absolutely.
And I'm Austin. You can find me on social medias at Austin Lee PAC.
Leave us a 5-star review wherever you listen to podcasts, share it with a friend, and we'll catch you on the next episode.